A cluster headache is a pain that occurs on one side of the head. This pain often occurs around, behind or above the eye with a cluster or rotating pattern. The pain is very intense. Many patients describe the pain as a drilling drill in the head. The headache lasts from 15 minutes to a maximum of 3 hours. However, it can occur up to 8 times a day. Men are 2 to 4 times more likely to suffer from cluster headaches than women, however, its overall prevalence is very low, about 1 in 1,000. Due to its rarity, limited information is available. Although the vast majority of sufferers are adults, this type of headache has also been reported in children under 6 years old. What are the signs and symptoms of a cluster headache? Cluster headache is always unilateral. However, the location of the pain may change in some people. Most people with cluster headaches describe pain around or behind the eyes. The pain may continue along the forehead, inside the jaw, or along the line of the teeth, or throughout the cheek. Often the pain may spread to the ear, neck or shoulder. In addition to headaches, many people with cluster headaches have signs and symptoms that may include wetting of the eyes. Some people may only have conjunctival redness, swelling or drooping of the eyelid, runny nose. People with cluster headaches may also have symptoms that are usually among the symptoms of migraine headaches, such as sensitivity to light, sound, or light may occur. However, unlike migraine headaches, movement does not aggravate cluster headaches. In fact, many people feel lethargic during a headache. What causes cluster headache? The specific cause and anatomical cause of cluster headache is not known. On MRI, dilation of the ophthalmic artery during acute cluster headache shows, while PET scan shows intrasinusoidal activity. However, in many patients with other headaches, disorders are seen in the same areas, so these tests do not show definitive results. There is evidence that the hypothalamus may be involved in the recurrence cycle of cluster headaches. Activation of the trigeminal ganglion may cause many changes in cluster headache, but the trigger for activation of this region has not been identified. What triggers a cluster headache? Many patients experience the onset of their headache while sleeping. In addition, alcohol can trigger cluster headaches in patients who are in the middle of a headache cycle. Histamine and nitroglycerin can trigger cluster headaches in patients. Seasonal change is also a trigger for some patients. Some patients have cluster headaches that change with environmental changes or changes in stress or activity levels. It seems that hormonal or menstrual factors do not cause cluster headaches. Other factors include smoking and family history. How is a cluster headache diagnosed? Diagnosis of cluster headache is usually done after reviewing the history of headache and physical examination. Cluster headache is unique in its presentation and history is often sufficient for diagnosis. While no specific imaging study or blood test can confirm the diagnosis of cluster headache, an MRI or CT scan of the brain can be used to confirm that another factor has not caused symptoms similar to cluster headache. In some cases, an eye examination is needed to assess the presence of a problem inside the eye. What is the natural or medicinal treatment of cluster headache and related symptoms? Cluster headache treatment can be divided into 2 distinct categories. 1. Relieving acute headache. 2. Prevent future headaches. Mask oxygen helps the majority of patients in the short term. However, it is difficult for the patient to carry the oxygen device. Injectable sumatriptans are beneficial in many patients with cluster headaches. This treatment causes interference in patients with heart disease or untreated high blood pressure. Nasal spray or oral version of this drug has less effect. Intravenous dihydroergotamine can be very effective in the treatment of cluster headaches, but it can only be used once in 24 hours. Lidocaine nasal spray has also been suggested as a treatment option, but it must be administered prescribed and if it is not used correctly, it is ineffective. Steroids can be very effective in reducing the headache cycle. But it should be used for a short period of time because long-term use can lead to serious side effects. Verapamil, lithium, valpuric acid, topiramate and melatonin can be useful in reducing the frequency and severity of cluster headache cycle. In severe cases, surgery is recommended. Radiofrequency lesions of the trigeminal ganglion can reduce the frequency of cluster headaches, but are associated with significant side effects and innervation. Can cluster headaches be prevented? When cluster headaches are correctly diagnosed, long-term treatment can be beneficial to reduce or prevent future cycles. However, it may take some time to get the headache cycle under control. What is the prognosis of cluster headache? Over time, the frequency of cluster headaches decreases, but it may take several years. Cluster headaches can go away for a long time and then return to normal. In the same way, you will meet with your doctor about the need to continue treatment. Cluster headaches do not seem to be associated with other neurological diseases such as Alzheimer's, Parkinson's disease or multiple sclerosis. However, many people with multiple sclerosis experience severe headaches. How long do cluster headaches last? When the cycle of cluster headaches starts in different people, its length is different and it can happen every other day and once a day in some people, or every day and up to 8 times a day in others. Involve them also. Headaches can last from 10 to 15 minutes to even 3 hours. Are cluster headaches dangerous? No, fortunately, they are not dangerous and do not cause permanent damage to the brain. However, due to their repetitive and unpleasant nature, they can reduce the quality of life. So, the best thing to do is to know the triggers of headache and avoid them.